Right, thank you very much for staying with us right here on Diaspora Vibes. Remember, if in case you're joining us right now, the platform to use to communicate with us on the social media, it's at TV47KE across all of them. You might as well send me a direct tweet on my handle at Owino with the hashtag Diaspora Vibes. Now, let's move on to this segment where we have a studio interview with Ndegwa, and she's here to help us discern the information that's being accessed online and how the digital platforms are playing a key role in that. Masi?
Yes.
Thank you very much for joining us right now.
Thank you for having me.
Yeah, now just to kick off this conversation, I'd love to begin with a recent update that just came out a couple of hours ago. We had an article that surfaced online, and I want to believe this was published by CNN, London, and the article says, Facebook has a coronavirus problem. Mm-hmm. It's WhatsApp. That was the title of the article, right? Mm-hmm. It says Facebook has a coronavirus problem. It's WhatsApp. What's your take on this? And secondly, where are you sitting from? Do you believe there's a lot of misinformation going around with regards to the coronavirus?
Well, so thank you for having me again. It's a delight to be able to come and join in on this conversation and share on what Facebook is doing as an organization and what efforts we're contributing towards this issue. We realize that the COVID-19 issue is a really serious matter. We as a company have put a lot of effort to see how much we can do to address a certain number of things, including misinformation, which I believe is the genesis, basically, or underlying point with this piece of content you're talking about. Now, with misinformation, misinformation has always been a challenge that we have generally. And so even prior to this COVID issue, misinformation is something that we have because people will come online and they will try to share different things according to their own perspectives, whether informed or otherwise from different sources. And what we're doing as a company is a number of things. One, we're trying to make sure that people have access to the accurate information that's available on COVID. What does that mean? That we're working very closely with global health organizations such as WHO and others to make sure that whatever information they have, they can then use our platform to share that and broadcast it to people around the world. We are doing this by supporting them with, for example, ad credits, so they can promote content that they feel needs to be seen by many people at the same time regarding the issue, so that people have accurate information. Over and above that, we are supporting fact-checking, where we have third-party fact-check organizations across the world. Here in Africa, we have Africa Check, for example, AfriCheck. We have Pesa Check in Nairobi, actually, even, who help us also to make sure that the information that people are seeing online around an issue is verified as true or not. And what that will entail is then, with the collaboration we have with the health organizations and the government, for example, the health ministries, they can send any information or misconceptions that are there around COVID to these third-party fact checkers to say that this issue is actually not true, and the third-party fact checkers then can be able to inform us to scale it down, like remove it from visibility by users who are on our platform. But over and above that, we are also taking down anything that is actually either deterring people from seeking treatment or giving them erroneous information about a true source of information. So, for example, anything that is pretending to provide a false cure, saying, for example, you can drink bleach to be able to be cured, we'll take content like that down. So we're doing a lot of efforts to tackle the issue of misinformation by third-party fact-checking, working closely with World Health Organizations as well as other global authoritative health organizations to provide the correct information and make sure that people see that when they come onto our platforms. You may see, for example, very soon, if not as soon as today, when you log on to Facebook, for example, here in Kenya, that you'll be able to see a pop-up. When you search for any information relating to COVID, you get a pop-up that tells you, that leads you to correct sources of information here. So, for example, a Ministry of Health website that has updated information that has been verified by the ministry and other people that they're working with, partners such as WHO and others, so that people at all times are linked to the right information when they go online. Same case for Instagram. If you search for hashtags touching on COVID or Corona and so on, then we'll actually also link you to correct sources of information. So we're trying to do a lot on that area to make sure that people are continuing to get what is accurate and that it's also...
All right, but just to, before you actually move away from that point, you speak about third-party fact checkers. Now, when we have setups and platforms like this, it reaches a big mass of people, and different people might not have the same level of comprehension as compared to the people in the upper class. You talk of third-party fact checkers. Could you kindly just elaborate on what this is about and how it helps in this?
So third-party fact checkers tend to be organizations that we partner with as a company to help us with verifying facts that are being seen online. It could be facts that are reported by users coming across them online, or facts that will be picked up by organizations that have the true or genuine information on that piece of content. And so what they do is they bring it to the attention of to our attention, and the third-party fact checkers actually also proactively seek out content, because they're constantly online checking what information is going around on an issue. So for example, on COVID, they will go in to see whether there's stories going around about a cure, stories going around about where you can buy treatment that might cure you from this, or things like masks and things like that. And if the information is incorrect then, or found to be false, then they will alert us for the action to remove or reduce the visibility of that content to be taken. So that's what the fact checker organizations do, and they're separate and independent from us. We don't direct them. They will come to us and tell us, we have verified this piece of content to be false, and then now the relevant action will be taken according to the policies that we have on misinformation.
All right. Now, Facebook is an international digital platform, meaning it actually reaches out to different people. Everybody across the broad uses, but I want to believe the first world countries and the African setup is a different setup, so to say, the consumption levels and all that. So what is Facebook doing in particular, partnering with the African governments to ensure that this information is laid out responsibly?
So one, I've already talked about some of what we're doing at the global level, but we are doing similar efforts also on the ground in terms of local engagements. For example, here in Kenya, we are partnering with the Ministry of Health that is championing some of this work, together with the Ministry of ICT through the government spokesperson's office, to see how we can support the use of our platforms to make sure that people who are online on our platforms can get accurate information quickly and get it from verified sources. And how we're doing that is making sure that, for example, one of the things you'll see is the Ministry of Health page, for example, is verified, meaning that it has a blue tick. And what that helps is that then users within Kenya are able to know that this is the true and the authentic page for the Ministry of Health, and any impersonations of that page, for example, that may exist, because people may create pages that are impersonating this one, are not the true source. And those we will actually also action by taking down when they're brought to our attention, and usually we'll try to find those out once we know we have verified an account. So verifying an account gives authenticity to this page as the one that is giving you true source of information. What that also means is, one of the other things we're also doing with once the page is verified, is we are supporting with what we're calling the ad coupons or ad credits. What that means is we are waiving or taking on the cost for government to, for example, promote certain pieces of content they may want Kenyan citizens or anyone, for example, in this region or within sub-Saharan Africa to see on COVID. So in the case of Kenya, if the Ministry of Health feels that there's a huge need for people to understand hand washing as an issue, or social distancing, or whatever messaging they want to make sure the public has around COVID, then they will use that page to promote that content, and we don't charge them for that. That cost is borne by us. So that's what it means by we've waived the costs, and by giving them a fund to make sure that they can expense it accordingly for anything that they want to put out there to the public. Over and above that, we are providing them with what we're calling the WhatsApp API. What that will enable government to do, as well as relevant health organizations here, is to be able to also hear from the public on issues or queries they might have. So for example, you might want to message and say you do not understand, or you're not sure which health center around you can maybe test you for what you feel as symptoms of COVID-19, then you can actually then get information back. So we already have developed the bots, so it's just to link the relevant government authorities that we are provided with that, so that they can then be able to engage with the public directly. In addition to that, we are also supporting with what we're calling Workplace. Workplace is a tool that we have, and we've waived the cost for this as well. It's free to government, to make sure that and any health organization for that matter that will be working on this issue, to make sure that they have access again to developing a community around. So for instance, one of the very detailed operations I've seen is the structure of health workers from the top all the way down on the ground. Is an entire community of very many people, and Workplace allows them to have a community online on on our platform,
right.
to be able to have now the top, maybe cascade down information specific to how do you handle patients, what do you need to know in this situation, is there news updates that you need to share, videos on training, and anything that they want to. It becomes a closed community that they can actually interact within themselves to be appraised on situations simultaneously across at the same time. So there's a number of interventions that we're putting in place. In addition to that, we are supporting in terms of making sure that we provide fundraising tools. We are doing this already with the United Nations Foundation in collaboration. They're doing this, the United Nations Foundation together with the WHO Foundation. The WHO have a fund that they're running, a fundraiser on Facebook to raise money, and we're matching the amounts that they raised to about $10 million to $20 million, I believe. And over and above that, we're also going to be supporting CDC, who will also be doing a similar effort of fundraising to support this issue of COVID, and we'll be matching that fund that they raised to about $10 million similarly. So there's a number of efforts we're putting in place. In regards to small and medium-sized businesses, we realize that a lot of businesses are struggling at this time, or there's foreseen challenges that will come up as a result of this situation of COVID. It's having a huge economic impact as well.
Definitely.
And what we have seen is we have seen and heard from those who are using our platforms as small and medium-sized businesses is that they are struggling to keep the business afloat. And what we have done is set aside a fund of about $100 million that will be availed to about 30,000 businesses across 30 countries, where Facebook has employees, to make sure that we can be able to keep them going during this time that they're going through these challenges. So there's quite a number of interventions and things that we're doing, and we continue to be dynamic as an organization to pay attention and see how we can respond and help along with this issue.
Now, one of the critical things when it comes to verification of these accounts and the platforms that people use to share this information, you've talked about blue ticks, right? The account, if it has a blue tick, then it means it's been verified. In most cases, we've had cases where people and hackers and different people who generally know their way around the tech world actually make their own blue ticks. Is this something that you had to deal with of late? Because I want to believe if somebody sits somewhere, it can actually create an account that looks like it's verified and actually still share the same information. Are you pegging your judgment on this blue tick that this is specifically verified, or you've had cases where some accounts look verified but they're not verified?
I actually haven't encountered that myself. On our platforms, we have a very clear and secure process for verifying accounts. And once we verify an account, we provide additional information to the user of the account or page to inform them of how additional measures they can take to secure that account. Because now, with the blue tick, there's probably more interest in, for example, hackers to try and get into this account and pose it as though they're the account owners. And so what we do is we share information, for example, on two-factor authentication and how they can enable that, so that then there's added security on their accounts. So we do provide additional information during verification to the users of those accounts to secure their accounts. But we have not seen this
you haven't experienced this. No. And do you have any policies or legal action that's being taken against people who share misinformation or anything that goes against the Facebook guidelines?
So we have, like I said, misinformation is a challenge that we've always dealt with. We have a very clear set of policies. We call them the community standards. And our community standards guide how we determine or govern behavior online on our platforms. Now, in the community standards, we have different policies that address different things, and misinformation is just one of the areas. And what happens is those policies will be very clear in regards to if there's a violation to any one of them, there's a very clear cause of action that will be taken by our content reviewers, for example. So yes, we do have, there's repercussions for circulating information that is false. There's certain things that we do, especially where violations to our standards have happened. We do have strikes against that account. If there is repeated false information that is harmful to people especially, then we actually do also take action to remove the account in its entirety. All right.
So just as we wrap up this interview, I'd love to ask you, there also has been rumors and just general talk outside there that COVID-19 and all the saga surrounding it is some sense of conspiracy. I believe that you've also come across this conversation that this is just conspiracy. Some people are trying to use it towards this. And what's your advice coming from somebody who's handled information going out to the people out there? What could you tell these people or about the COVID-19 situation in regards to these conspiracy theories that are everywhere and in every corner?
My guidance and the guidance from Facebook would be to always rely on the accurate sources of information that we have availed through our platforms.
Yeah.
We have made very intentional and deliberate efforts in making sure that we identify the right partnerships with the right organizations that have the correct information, including partnerships with governments across the world, especially where we have the confirmed cases, to make sure that those then become the authoritative sources of information and that we have availed that information and make it accessible to our subscribers or users. So, for example, like I was saying earlier, on Facebook, we are allowing, for example, things we call like quick promotions, where users in every country where there's a confirmed case will be able to get a pop-up that leads them to the information source. That is coming following very detailed engagement with government and World Health Organizations, as well as other authoritative health organizations, to make sure that then they link to that correct piece of information. So we are trying as much as possible to enable access to accurate information as the first thing. We are trying as much as possible to make sure that people stay connected and close to their families, especially during this time when you have social distancing when it comes to physical distancing. So we're making sure that people stay connected to their families and their friends and others, which is a big part of the mission of Facebook, that people then stay close to their families. And also we are trying to make sure that over and above that, anything that is harmful, they're not coming across. And if they do, we are taking very proactive measures to make sure that that is taken down as quickly as it's also reported to us. So encouraging people also to bring to our attention through the reporting tools anything that they come across that may be worrisome, and we'll take a necessary action.
All right, Ms. Ndegwa, thank you very much for your time.
You're most welcome.
I wish I could shake your hands, but you know, I do, so I'd say namaste.
Thank you.
Thank you.
Thank you for having me.
All right, that was a Studio interview that we had with Ms. Ndegwa with regards to access of information on the digital platform. But at this point, we'd love to take a short break, but we'll be back with more. Do stay with us.